Hello, everyone. Welcome to a session and a discussion on tinnitus and hearing loss, and understanding the details of tinnitus, some of the facts and information about tinnitus or tinnitus, you can pronounce it either way, and hearing loss and how those two things are related. Sometimes they're not related, but the relationship between our ears and hearing, and then those of you that have tinnitus or tinnitus or know someone or have a loved one with that. So the relationship between that, and also some treatment options for what we're going to do. Those are the things we're going to talk about today. My name is Leslie Staverman. I am the Director of Educational Development here at Widex USA, and it is my pleasure to have the opportunity to do a little quick presentation, allow you to watch it, to gain some information, and hopefully help with some understanding of what's happening with your hearing and tinnitus, again, for you and or your loved ones. So just a quick, again, review of the things I want to talk about today. We're going to talk about tinnitus in general, a little bit about hearing and hearing loss and how that works. We're also going to talk about how hearing loss and tinnitus, specifically tinnitus, affect you and your loved ones in your everyday lives. I also want to spend some time talking about reviewing the various tinnitus treatment options out there. That things in the world of audiology have changed dramatically in the past few years, and we are able to help people with tinnitus so much more than we've ever been able to do in the past. So that is a wonderful thing. It's something I specialize in, is working with individuals with tinnitus and tinnitus patients, and enjoy it so much. It's one of the things I'm very fortunate I like about my job, about my job, is that I can really make a difference for people that are suffering from tinnitus. And then, of course, we're also going to talk about some of the different treatment options. And here at Widex, we have the most revolutionary and the most sophisticated tinnitus and hearing treatment devices available today. Of everything that's available and things that are being talked about, Widex set the standard. We invented some of this technology, and we hold the patents on this technology. And once again, we have the most sophisticated, the most advanced treatment options and functionality of those treatment options for tinnitus patients. Definitely leading the field and the industry in this topic and in the rehabilitation of tinnitus. Those are the things we're going to talk quickly about today. So real quick, what is tinnitus? What is it defined as? What does it mean? I think tinnitus, again, or tinnitus, it can be pronounced either way, is correct. Tinnitus is something that's often misunderstood. It is misdiagnosed frequently and very much misunderstood by many people, by family members, by friends, by individuals that have tinnitus, experience tinnitus, and even by some other medical professionals. I recently had the experience of talking to a general practitioner, and tinnitus came up, and he informed me that it wasn't really anything that was there. Well, that's not true. It is. It is real. It's something that if you have it, we understand and that you hear, and it is absolutely something that we have different treatment options for today. So tinnitus is defined as a ringing or similar sensation in the ear or in your ears. And when we talk about ringing, kind of a buzzing or a high-pitched, staticky sound, some people report it as sounding like a humming or a roaring sound like an ocean or crickets. My dad suffered from tinnitus, and he always talked about the crickets, and the crickets were out again. That is a sound absolutely that we have, and we hear it sometimes all the time, sometimes randomly, sometimes in one ear, sometimes in left, but it absolutely is that kind of sensation. Again, there are some people that hear it in one ear versus two. Some people hear it in they describe it as being, in the back of their head, or kind of more like sometimes different headaches. So there's no right or wrong. There's no that it's always in one ear, or it's always in both ears, or that it always sounds like a hissing or a buzzing sound. It is something that manifests itself in many different ways, and it's very individual. So individuals with tinnitus report very different things, and it absolutely has been, reported and documented and is happening. There are hundreds and hundreds of different causes of tinnitus, and we're going to go through a few of those a little bit later. But there are many different causes of tinnitus. one of the most prominent causes, or the most highly statistical cause of hearing loss is of tinnitus, is hearing loss. Over 75 to 80% of individuals that have hearing loss also report tinnitus. Different types of tinnitus, different loudness levels, frequency, how often does it occur. The other thing we're going to talk about again in a little bit, but I want to point out, is there is no cure for tinnitus. Tinnitus is something that we cannot cure. That does not mean that we cannot help, does not mean that we cannot offer many different options and some therapeutical things that can use. We have in the past few years had extreme success with helping individuals to relieve the annoyance of their tinnitus. Some people it goes away, they don't hear it anymore. So absolutely certain therapies and certain options have been proven to offer significant relief for tinnitus. But I want to make sure everyone understands you cannot take a pill, you cannot eat something, you cannot get a shot, and all of a sudden you're cured of your tinnitus. There is no cure. When you have it, it is there, but there are amazing, absolutely amazing treatment options, and that's what we're going to talk about as we continue through this presentation. So some facts about tinnitus, I've mentioned a couple of these. Over 50 million Americans report that they have tinnitus. That is more than report hearing loss. So just because you have a hearing loss doesn't mean you're going to have tinnitus. And many individuals that do not have hearing loss, they have perfectly normal hearing, also report having tinnitus. It's about 15 to 20% of the general population, that over 50 million Americans. 75% of people that say and report that they have ringing in their ears and that they hear buzzing in their ears, it's more of an irritation, meaning it's not something that causes them to be debilitated. It's not something that causes them to not be able to go to work, to not be able to function. But there are 25% of people that the tinnitus is so significant, it is extremely difficult to function, it's extremely difficult to get up in the morning, and many of the other problems and things that happen with that. There are over 2 million people, of that 25%, over 2 million people that are seriously disabled by it. Only about, of the 50 million Americans that have tinnitus, the recent study showed that only 16 million seek treatment, want to get out there and want to find out about it. And that's something that we at Widex feel very strongly we need to work on, and we need to increase that number, because there is help out there. A lot of people, if you go to many different medical professionals, or if you talk to friends, and a lot of comments are, well, just get used to it. Just learn to live with it. That's not acceptable, in my opinion, and it's not acceptable in the belief of Widex. We very much know that there are successful treatment options and have had huge success with that, and want to continue to help people manage and function without this horrible tinnitus, this ringing and buzzing and sounds in the ear. And as I already mentioned, 70 to 85%, 75 to 80% of hearing impaired individuals also report tinnitus, that they do have that and hear those sounds. Real quick, I want to review the anatomy of the ear, because I want to explain where tinnitus is coming from and what is happening with tinnitus. So this will be a review for some of you, but remember that the ear is one of the most sophisticated, advanced systems in our body. There are many, many different parts. So if we look at the ear, we have the outer ear. This is the part that sticks out. This part gathers sound. So it gathers sound. The sound then goes down into the ear canal. It then hits the eardrum. It then goes into the middle ear. The middle ear has 3 little bones, and those bones move back and forth. The sound then goes into the inner ear, or the cochlea. And that is where the sense organ, or the individual sounds, individual definition of speech and environmental sounds and sound, that's where it's defined. All of these different parts of the ear must be working correctly in order for us to hear and understand what's happening. So remember that it's not just a simple process. There are many different parts involved. Now, there's a couple different types of hearing loss. One is called a conductive loss. This occurs in about 5% of people. And what this means is that you have a blockage of wax. That's one potential cause, and the sound can't get into the ear. Sometimes people have a hole in the eardrum, and the sound goes right through. Sometimes people have their bones of their ear break. I bring this up and I tell you about this because people, even if they have a conductive hearing loss where maybe there's a hole in the eardrum or the bones in their ear are broken, many of those individuals also report that they have tinnitus. So please don't let anyone tell you that tinnitus is only caused by a certain type of hearing loss, that it's only there for people that have different types of hearing loss or certain characteristics. It can occur anyone. And again, people with normal hearing can have tinnitus. The second type of hearing loss, the most common, 95%, is called sensorineural or nerve loss or nerve deafness. Many different reasons for this, many different causes. And since this is the most common type of hearing loss, we do see tinnitus more often in a nerve loss or a nerve deafness or a sensorineural hearing loss. But again, it's not that it only occurs in this type of hearing loss. And the thing to remember about this type of hearing loss is that inside the organ of hearing, I just blew it up on the screen, I hope you can see, inside the organ of hearing, there are little tiny hair cells, these white little strings on the screen. There's over 10,000 hair cells in the cochlea, and those hair cells are the sense organs, and there's fluid within this organ, the cochlea, and it moves across the hair cells. And that fluid moves across the hair cells, they move. The best analogy I can give you is if you have a pond and there's, some water plants or some things sticking out of the pond, and when the pond ripples or when waves go across the water, those things move, right? Even in the ocean, right? Seaweed, right? It moves when the waves go through. That is what happens to these hair cells. So as the fluid moves, okay, those hair cells move. And we're going to talk about that more here in a little bit, and that's very much part of tinnitus we need to be aware of. So when you have a hearing loss, you're missing some of these, as you can see in this picture, hopefully. You're missing some of those hair cells. Some of those white hair cells are missing. I want to show you this picture. This is a normal hearing cochlea. You see the hair cells are black. They're not white. All these little strings that are here on the screen. And then this is a picture of a damaged ear or a cochlea, the organ of hearing, where those black little hair cells are missing. So this person has a hearing loss in that situation. And again, this is tied directly to tinnitus, and we'll talk about that in just a minute. When we think about the entire auditory system from what I've just shown you, so again, the pathway, the sound from the outer ear, middle ear, inner ear, it goes into the cochlea. It then travels across what we call the eighth nerve, which is this blue line, and it goes into the brain. The last part of hearing is in your brain. It's a little tiny area. It's kind of right here, if you can see my cursor, right there in the middle. It's on either side, both sides of your brain. It's called the auditory cortex. So all the sound gets heard by the ear, the middle ear, the inner ear. It stimulates those little sense organs, sends it on a nerve, the eighth nerve, up into the brain, but the brain understands it, and the brain processes it, and the brain has to hear it and process it in order for us to hear. Now, that is what is happening when we think about tinnitus, is this is all correlated. What we know is that when you have a hearing loss, we have auditory deprivation, right? Meaning the hearing loss is causing the brain, right, not to get the expected sound. Our brain is used to hearing. We are born and we are hearing. In fact, there are many, many people, I believe this, that the babies hear in the womb. So our ears develop and we start hearing. And our ears don't shut off, and we don't ever stop hearing. Even when you're asleep, there's still sounds, they're still getting to the brain, but the rest of our brain says, okay, don't listen to that, right? Take a break. The point being, it deprives the brain of the expected sound or the expected stimulus that's coming in. So when we deprive the brain of the stimulus and of the expected stimulus, what's going to happen is the auditory system becomes more active. So if the brain and the auditory system is not getting the sound it knows it should have and that it needs, the result of that is often that that auditory part of our brain says, wait a minute, I should be hearing. I should be getting stimulated here. I need to get that. And it kind of creates sounds itself, because tinnitus at the end of the day is the auditory system. Anywhere along that path and all those parts is creating a sound that does not have a sound in the environment. So what that means is the auditory system, the ear, the cochlea, the nerves, the middle ear, somewhere in that, in the auditory cortex of the brain, something is misfiring. It's saying, hey, I'm creating a sound, but there's no sound in the environment. So by lack of stimulation, by lack of sound, by lack of that, that is what many, many researchers believe is a result of tinnitus, one of the most common things that results in tinnitus when we think about. So what we have to do is we have to flip a switch, and we have to say, we've got to get the brain active again, right? Because if it goes by itself and it starts creating sounds, it can result again in tinnitus. So just some things to remember to think about that. Again, some of the common causes of tinnitus: hearing loss, one of the most common causes of tinnitus. Some other causes of tinnitus: exposure to loud noise. I'm sure some of you have been exposed to a very loud noise and all of a sudden your ears ring. That happens a lot. Earwax, middle ear disease, can cause tinnitus. TMJ, we call it, which is temporal mandibular joint disorder. That's where your jaw meets your skull, right? It hurts. A lot of people go to the dentist and say, man, I've got some pain back there. And it's actually your jaw. It's called TMJ. But that can result in tinnitus also. Cardiovascular problems. The ear is filled with blood. It is filled with our circular system, right? Our circulation, and blood goes in there all over the ear and all the parts of the ear. So absolutely, there are individuals when they have some heart disease and some things there with the cardiovascular problems that will result in tinnitus. Different diseases of the inner ear, Meniere's disease attacks the inner ear, and that can cause tinnitus. Medications. I think it is very hard to find a medication today: aspirin, Tylenol, Aleve, Advil, sinus sprays. Most medications today, when you read the very, very fine print, I have to get my super bifocals out for that, and you read the fine print, it's going to say a side effect may be tinnitus or ringing in the ears. And we do see excessive medications. Now, we have to take our medications, but absolutely it can, excessive amounts and in different people, can cause ringing in the ears. And again, high blood pressure, your circular system and how our blood is pumping through our system, that also has been directly correlated to a cause of tinnitus. So just to give you some ideas of some of the different causes of tinnitus. Some of the aggravating factors, and this is something about tinnitus that we all need to be aware of. Tinnitus absolutely can be exasperated or can get worse. It can be more frequent. It can be more obvious. It can be louder. It can be more annoying when we have high levels of stress. When I work with patients and they tell me their tinnitus is getting worse, or they've all of a sudden started getting ringing in their ears and they come in to see us as doctors of audiology, one of the things that I ask is, when did this start? Have you noticed when it got worse? And if they say yes, then I say, what else is going on in your life? Some of the most stressful things: new jobs, marriage, death in the family, right? Relocation, moving, children. So many things can cause our stress level to increase. And absolutely, higher stress is one of the most common of aggravating factors that leads to further difficulty with tinnitus. Again, some medications, absolutely a direct correlation to excessive amounts of aspirin. I take a couple aspirin every day. Many people do, but many aspirin, too many aspirin, can also aggravate tinnitus. Salt is something that also, that sodium content can also add to the aggravating or the intensity of tinnitus. Smoking, alcohol, caffeine, definitely related to that. And we've already talked about loud noise and being exposed to loud noises. So if you have tinnitus, try to avoid these things or do more moderation. I work with patients sometimes who tell me their tinnitus is very bad around 9, 10 o'clock in the morning, and it gets better throughout the day. And when we talk to them, and one of the things I always ask is, do you drink coffee? And how much coffee do you drink? And quite a few of those people have 5, 6, 7 big cups, or, you know, our tall grande things at Starbucks. So the intake of caffeine, again, alcohol, tobacco, those things all can be aggravating factors to the severity of tinnitus. Tinnitus impacts us in so many different ways. Trouble sleeping. We see people so often that say, my tinnitus gets worse when it's quiet, and I have trouble falling asleep, or I wake up in the middle of the night, which then can very often lead to drug dependence, especially sleeping pills, anti-anxiety medications, things like that. And frustration and despair, right? It is when you have tinnitus and when you have ringing in the ears, it's very frustrating. It's, you know, depression and despair. Those are things that absolutely happen. I've got this problem, I can't fix it. One of the biggest problems with tinnitus is you can't control it. You can't say stop. You can't, there's no medication that stops it. There's no ability to go in and to say, this is horrible. So also a lot of people have loss of concentration or confusion, pain, headaches, muscle tension. Again, we talked about stress. People get mad. People get angry and irritated sometimes when they have tinnitus because they can't control it. There's nothing that they can do to control that. So when we think about stress, I've talked about it a couple times. Stress is horrible, and people with tinnitus absolutely, in general, have higher levels of stress. So our goal is, how can we reduce that stress? How can we minimize the negative impact of tinnitus? That's what our goal is. And what happens is, when you have tinnitus and you have stress, the stress increases, you hear the tinnitus more, then the tinnitus increases, then you get more stress, and it becomes this vicious cycle of uncomfortableness, not hearing well. You know, with that, people say all the time to us that tinnitus interferes with their ability to hear and function, and absolutely, that can happen. So the relationship between tinnitus and stress is well documented, and we see it all the time. The other thing I want to mention is not everyone with tinnitus reacts the same way. Some people that have tinnitus, they hear it all the time. It doesn't bother them. They have a minimal reaction. They don't worry about it. People say, well, I deal with it. Now, when we probe and ask more questions, sometimes it is more irritating, okay? And we have, you know, mild reactions. So there's different reactions, negative impact of tinnitus on daily life. So if you know someone who has tinnitus and they complain about it, don't dismiss it, right? It is something that is very much disturbing to them, that's causing problems, and something we absolutely want to be able to help and treat and work with. As I mentioned, there is no cure for tinnitus, but there are many different treatment options available out there, and that is what we're going to talk about, are the different things that we can do. I can't make the tinnitus disappear, I can't cure it, but I absolutely can treat it so it's not annoying. It's hardly ever there. A lot of people don't even notice it, and how we manage it and work with it. So if you're going to seek help for tinnitus, definitely find a hearing healthcare professional that is trained in treating tinnitus. Tinnitus treatment is something that is very different than fitting a hearing aid. And devices that work with tinnitus are not the same always as how you would fit a device for hearing. There are different options available, but make sure you find a hearing health professional that has treated many patients with tinnitus and has that experience. It's very important to ask those questions. As far as evaluating tinnitus, we will ask you to take some questionnaires. Those are, when do you have it? How often does it occur? How do you feel? So getting some questionnaires and some information. Also, many hearing health professionals can measure, okay, one, your hearing loss, but also the degree of tinnitus and how it affects your hearing and how it affects all those things. Please remember that tinnitus is a very complex problem, and there is no quick fix. There is no snapping your fingers or taking a pill, as I mentioned, or, you know, getting a device to help with tinnitus treatment and all of a sudden it's fixed. with tinnitus, we have to rehabilitate your auditory system. We have to use rehabilitative principles to go in and work with your tinnitus. It's very similar to other rehab we do. When you have a knee replaced or shoulder surgery or many different things going on, we have to rehab it. We have to go through rehabilitation. And that's what we're doing with tinnitus. We are going in and we are, yes, there are devices, yes, there are things, but there are also changes that we have to make, exercises, different things we have to do when we're treating tinnitus. So that requires counseling. It also requires education. So much information available at Widex. We specialize in tinnitus. We have many things available, and I know you'll have access to those where you can look things up and find more information. As far as treatment options, what we do for tinnitus is we use what's called sound therapy, and there are different types of sound therapy. Sound therapy is categorized as when you're introducing sound into the auditory system to help minimize the negativity and the negative effect of the tinnitus. 3 types of sound therapy. One is environmental sounds. I don't know if any of you are familiar with some of the sound generators or sound machines. You can buy them at Bed Bath & Beyond, Target, pretty much everywhere, Amazon, of course. And they're just recordings or machines of pleasant environmental sounds, rain, a pleasant rain, the ocean waves. Some people like spring nights where, you know, there's other sounds and the buzzing of the environment. Some people love to have a stream or a creek, you know, and the water rolling down in that way, or a forest at night. So those are environmental sounds. And what's happening is we're playing those sounds, and hopefully they're going to override and cover up the tinnitus. Noise. For many, many years, back many years ago when I became a doctor of audiology, what we did for tinnitus was we introduced noise, and that is just static noise. It is a static noise or a continual constant noise like a fan that is very repeatable, and it's the same sound. And it doesn't cure the tinnitus, it doesn't reduce the tinnitus, it covers up the tinnitus, and we'll talk more about that. And then we also have music for sound therapy. That's another type of sound therapy that we use that we use a lot of times in different things today. The goal of sound therapy is habituation. Habituation is, if you look at these 2 candles, if it's very dark and a candle is burning, the light just shines. It's very prominent, it's very noticeable. If you look at a candle burning during the day or in a room that has the lights turned on, you see the candle burning, but it kind of blends in with the background. So the goal of sound therapy for treating tinnitus, because we can't cure the tinnitus, is to help the individual, to help you be able to ignore or habituate to the tinnitus. It's there, it's going to be there, but put it in the background. Make sure that it doesn't become the most prominent thing that we hear and the most dominating sound that we hear. Okay, so kind of like taking the tinnitus that's very noticeable, the candle in the black background versus the candle in the light background or in the day in the sunlight, because it doesn't become as irritating, as noticeable. Talk about habituation. Habituation is wearing a watch. I wear a watch every day. I don't even feel the watch on my arm unless I get a new watch that I'm not used to, and then I notice it for a couple weeks. But habituation is, you know, do you feel your watch? Most people say no. If you wear a wedding ring, do you notice your wedding ring? I have been married for many, many years and don't even notice I have my wedding ring on, but I wear it every day, all the time. Again, hearing a train in a city. People that live in a city, we habituate to the sounds of the city. It does not disturb me or cause problems when I hear trains going by. I live in the city and the people on the street and things like that. If you're out in the country and you have a farm, the cows, they, you know, all night long they're baying, and the other animals, but when you live with it, you don't notice them unless there's something wrong. But me as a city dweller, if I went out to the country, I wouldn't sleep all week because that's all I would hear instead of my comfort. So we want to habituate. We want to teach ourselves to say, okay, yes, it's there, but we don't notice it, right? It's not something that we notice and something we don't focus on. Again, what that's going to do is that's going to help break the cycle, It's going to help going in and taking that cycle and allowing us to not be bothered and allow us to be able to manage the tinnitus and the different things that we do. So using music for sound therapy is something that we recommend. It is the most researched type of sound therapy for tinnitus and the most successful. Music does so many things when we listen to music. It affects our heart rate, our blood pressure, our muscle tension, our temperature, everything that goes on. Tears. Music can make us cry. How many of you have a song that when you hear it, you just cry? I do, because it affects us emotionally, right? Again, music, if it's a danger or a horror movie, you know, or a scary movie, right? It scares us, different sounds. So what we know is that music affects us in many, many different ways. And it's something that we feel can help us with our tinnitus. It can help reduce stress. It can also become that sound therapy that helps us habituate to the tinnitus. So in today's world, for tinnitus treatment, there are devices that are called combination devices. If you have a hearing loss, they will help you with amplification and hearing better. And if you also have tinnitus, we can also provide sound stimulation. Now, if you don't have a hearing loss, then we just work on the sound stimulation part. But the devices are FDA approved, which has to happen to be approved and recognized as acceptable treatment options. And that's what's important. So we can hear if we need help from hearing, but we can use the same devices at the same time to help rehabilitate our tinnitus and work with tinnitus. At Widex, we introduced this technology in hearing devices. It is called Zen, Z-E-N. That's just the name of it. And what we have is state-of-the-art devices that generate music. So the music is generated from within the hearing device, or what you look at. We call it tinnitus treatment device. We call it hearing device. They actually generate the music. It's not wearing headphones. It's not playing a recording of something. The device itself creates the music. Okay, creates the music, and it absolutely is the most clinically proven, independently clinically proven, successful tool for tinnitus management. So what we do is we play very soft, chime-like musical tones. It's not a song. It's not something that someone wrote. They are music notes that randomly play. This technology is patented by Widex. So what we've done is we look at your individual hearing, if you have normal hearing or a hearing loss, and we automatically write a prescription into the hearing aids to help create musical tones. Musical tones are for relaxation. They are very good at helping us relax certain musical tones. We have them set to the resting heart rate, very specific tempos, very specific notes that are used. And this technology is called fractal technology. We're the only manufacturer of listening and tinnitus devices that uses fractal technology. A fractal is something that is predictable or recognizable, but does not repeat itself. So let me repeat that. It is something that you recognize, a recognizable pattern, but it never repeats itself. I've got some pictures up on the screen. Snowflakes. Once we learn as children, that's a snowflake. There are no two snowflakes that are the same. That's what I'm told by the researchers of weather. There are no two snowflakes that are the same. But once you see it, you say, that's a snowflake. It's a recognizable pattern, but it never repeats itself. Many food, broccoli, cauliflower, apples, right? They look like an apple, but they're not exactly the same. Animals, zebras, leopards, anything that has stripes, you know, animals with stripes and colors. We recognize it as that animal, but no two, as they say, no two zebra has the same stripes. So this is important because what we do is we play these musical tones and they're random. They never repeat themselves. So the auditory system, the inner ear, the middle ear, the nerve, the auditory cortex in our brain, it is always looking for a pattern. So since the music notes never repeat themselves, the auditory system pays attention to those music notes. And when it pays attention to the music notes, it stops paying attention to the tinnitus. In some situations, it might actually stop the auditory system from misfiring, which is what causes our tinnitus. The auditory system is misfiring. We already talked about that. So this is amazing technology. Again, the goal and what we have proven is these Zen tones, these musical notes, they reduce the annoyance of tinnitus. They help with relaxation. Many studies have been done on relaxation, concentration. They distract away. We allow the auditory system, without telling it to, we don't have to say, ears, pay attention to the music. The brain and the entire auditory system automatically says, what is that? Let me find the pattern. Let me figure out what those sounds are. But there is no repeatable, right? There is no repeatable option. It's recognizable as music notes, but it never repeats itself. Key is that this can be used with anyone with tinnitus. If you have hearing loss or not, this is what we do with our tinnitus treatment options. There are various options, there are various adjustments, there are many different things we can do. So there's been many research over the past few years that has, again, gone in and has said combination devices for individuals that have hearing loss and have tinnitus, that the combination devices will not only improve your hearing, but they will help to decrease the contrast to quiet. They will allow you to decrease fatigue and stress, and all of these things help to habituate to the tinnitus. So that is what we do. We talked about tinnitus. We talked about the options for it. Again, it's called Widex Zen or Widex Zen therapy. And some of the things I want to talk about is this is amazing. I worked with a gentleman just yesterday, and very bad tinnitus. And he said, I need something. And so we said, let me just let you try something. And I put a tinnitus device on him. He had normal hearing, but I put this device on him, and I just turned it on. I didn't tell him what he was going to hear. I just turned it on. And he visibly relaxed in the chair. He's a young gentleman, right, in his 50s, very young. And he said, wow. He said, I just feel better. And he said, I have to really listen and try to find my tinnitus. It's just like it's not bothering me anymore. So absolutely. Now that was an instant reaction. Sometimes the reaction and the maximum benefit is not immediate because we're working with the smartest thing in the world, which is our brain. Our brain does more than anything else. And we have to say, hey, auditory system, stop paying attention to that tinnitus. I can't cure it. I can't make it go away, but I can say, let's stop this. Let's treat it. Let's rehabilitate the auditory system, right? There have been many, many studies, and you can look these up online, about how this technology has improved overall quality of life. So as I've mentioned before, this technology, Widex Zen Tone, has been proven by independent clinics. It helps promote relaxation. It helps reduce the annoyance of tinnitus. It helps reduce the disturbance level of tinnitus. 100% of people in some studies have reported that using this technology, the sound therapy technology, specifically designed, patented by Widex, helps to decrease tinnitus symptoms. 100% of people received benefit from this technology, and that's unheard of in the medical profession. So again, this technology, these tinnitus devices, again, they're combination devices. They can be used for hearing loss and tinnitus treatment. They can be used just for hearing loss. We're talking about tinnitus today. They can be used just for tinnitus. Many different shapes and sizes and options and how they look. They're not big and huge. They may look on the screen, but they're very tiny. Many different things, many different price points. Again, they have been FDA approved for tinnitus management, combination, and hearing aid use. Again, this technology, we are patented. We have it. It is the most successful tinnitus treatment technology available. Those are the things that we have. Those are the things that are available. So again, thank you for listening. Thank you for watching this video. Hopefully I gave you some great information and you were able to learn and maybe find some education or find some information that helped you, and hopefully we were able to educate you. So thank you very much. I hope you all have a great day or evening.